The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering any type of vein treatment. And the topic today is new treatment options for people with varicose veins, unsightly veins on the hands, body, or face. With us, we have an expert on the topic, Dr. Nichols. Dr. Nichols, welcome to the program.
Thank you.
Now, before we get into today's topic, tell us a little bit about your vein center.
We see the gamut of veins. We see people who have no symptoms with spider veins all the way to people who have big ropey veins with pain, swelling, heaviness in their legs, even people with ulcers that will never heal on their legs, people who get blood clots and eventually go to their lungs and can kill them.
You're also board certified in phlebology. What is that?
Phlebology is the diagnosis and treatment of vein disorders. It encompasses anything from arm or leg veins, spider veins, to big ropey varicose veins, and also to ulcers and trouble with the blood clotting.
So pretty much, I guess, anywhere in the body you can eliminate a vein if it's unsightly.
Pretty much. Okay. We can treat veins on faces, we can treat them on the backs of hands, we can treat them on the chest, the back, the breast. But mainly what we do is treat leg veins.
Now, the big varicose veins, this is interesting to me. They're still done in hospitals. Is that correct?
No.
They're not being done in hospitals?
They are being done in hospitals, yes.
But you're saying it doesn't have to be that way.
Correct.
Tell me about that.
We can do everything with the veins in the office. It's definitely a different day than it was for your grandmother when she had the vein stripping and was laid up in bed for 6 weeks. We can do it now in the office, usually in about an hour, and then the next day you're back to normal.
So there is no downtime, I mean, for the most part.
For the most part.
You can go back to work the next day after even a big ropey vein.
Most people can go back to work the next day, even with the big ropey vein, because we're not doing vein stripping. We don't have any big incisions or scars, and we usually put somebody in some wraps, and the next day they can go back to their business.
So what are the different techniques, then, you're using? What do you call them to get rid of leg veins?
We have a lot of different techniques, and all of them can be done in the office. We do something called the venous closure, which is radio frequency, and we actually shrink the collagen in the vein just like you would shrink wrap with a hairdryer. We do something called the Elvis procedure, which is a laser that also shrinks the vein and closes it up. We can do that right in the office with no incisions at all. We can do sclerotherapy. We can do...
What is sclerotherapy?
Sclerotherapy is the injection of veins with a medicine that makes the veins stick together. And if they stay stuck together for a little while, they'll dry up and go away, and your body reabsorbs them. So You don't have to strip them out.
Now, with all of these procedures, and if they're just tuning in, we're talking about leg veins, and this is an outpatient procedure, pretty much no downtime. They can walk home if they wanted to?
Actually, once we do these, we have the patient walk immediately when we're done.
Okay, and just what? Wrap their legs?
We either wrap their legs or put on compression stockings.
So are you collapsing the vein? Help me understand that. Are you collapsing it with these procedures? Are you yanking it out? Dissolving it? What is it? What are you doing?
We actually collapse the veins. And interestingly enough, your body will actually reabsorb that vein. So you don't have to strip it out. You can shrink the vein, leave it there. Then you don't have to do any incisions. You don't have to pull the vein out. And your body reabsorbs it, and there's no downtime.
Is this pretty much your focus in the practice?
It is.
Why do you like it so much, by the way?
It's a chance to help people change their lives that even in emergency medicine, I never really had this chance. I have people who come in who have had pain for 30 years, and I've had people...
Really? I mean, people will say that.
They actually...
Pain.
Absolutely, pain.
So the varicose veins cause pain?
Varicose veins can cause pain. Even spider veins can cause pain. You have little nerves that actually run with the veins, and if you get a little swelling in the vein, then it affects the nerve next to it and causes pain. Back to the woman who came to our office who had had pain for 30 years. When she came in, I looked at her leg and said, I know why she's got the leg pain. She's never had these veins treated, and no one's ever diagnosed it. So we did an ultrasound.
So these leg pain, okay, these big veins can cause pain.
Absolutely.
Where's the pain coming from? Why is it painful?
You have nerves that run with the veins, even with the little spider veins, and if you get some swelling in the vein, then you get irritation of those nerves and it causes pain. And if you treat those veins and they no longer are swelling, then you won't have the pain. And that's the secret. So with her, she was a perfect candidate for the venous closure. And we took a little tiny needle, put it in the vein, and we actually
Sounds painful, by the way.
Oh, it doesn't hurt at all when you're doing that.
You numb it up?
We numb it up.
Okay.
And we also give you some medication before we do the procedure, so your brain is numb as well.
All right, okay.
And when you're done, really, you usually don't have any pain either. But it takes about an hour. We shrunk the vein with the venous closure procedure, and then I injected a couple of the other varicose veins. The venous closure procedure is like closing an open bathtub drain. And once you get that big leak closed, then you can plug your finger in the smaller leaks by doing some injections in the veins. And the combination works great. And she got up from the table, she walked to her car, and the next day she was totally back to normal. To her, the most surprising thing, besides the fact that her legs looked great, was that she had no more pain. After 30 years of having pain every day, she had no pain.
Well, how do they describe the pain? I mean, what kind of a pain is it?
A lot of people have a dull aching pain or just a heaviness sensation. They say that their legs feel fidgety and they can't get them to feel normal. And especially that can happen at night, something called restless leg syndrome. Also, sometimes it's a burning pain, it can be a stabbing pain.
And people just don't know about it? Is that what? I mean, are there thousands in your neighborhood, let's say?
Oh, there are.
Have it?
Thousands or millions in the United States. It's estimated that 80 million people have vein problems in their legs.
And if you have symptoms, I mean, insurance covers this.
It does, yes. And very few people realize that, even doctors.
And, okay, now I know you brought some photos. We're talking about new treatment options for people with varicose veins. And pretty graphic photos here. But before we go into that, the men and women are both doing this. And what are the age ranges? Can you be too old to get the treatment?
You can't be too old. If you're breathing, then you're young enough to have this done. I think the oldest person that I have treated for leg vein problems was 96 years old.
Really?
Yes, and they said that their legs felt 20 years younger.
What are the misconceptions, by the way, about this procedure? You smile when I ask you that, by the way. Why is that?
Oh, there are so many, and I hear so many stories every day. I think the biggest one that I hear is that they're going to have vein stripping, and that scares a lot of people.
That's the hospital procedure.
That's a hospital procedure where they put you to sleep in the operating room.
You hear that every day, really?
I hear that every day, yes. People just don't know about the newer technology. With the typical vein stripping, people would have to be off their feet. They basically had 6 weeks of downtime, and they would have pain, scarring, swelling in their legs. Not many people can really afford to take 6 weeks off of work these days.
Okay, so somebody wants this big ropey vein. They go to you, you do an ultrasound, and you can, this venous closure, you're taking a laser that is going in and collapsing the vein.
We use, with the venous closure, it's actually radio frequency.
Okay, radio frequency.
Yes.
So it heats the vein.
It heats the vein up, and it shrinks the vein just like you would shrink wrap with a hairdryer.
But don't you need those veins?
We actually have 3 sets of veins in our leg, and if you happen to wipe out all of the veins that you can see on your leg, you're probably going to do just fine. If one pathway gets closed down, then you have another pathway that just takes over and the blood reroutes. Another misconception is that it's going to hurt a lot. And that's somewhat frustrating to me because we can do the procedures right in the office, and an hour later they're walking and going home.
But with sclerotherapy, asking around, okay, knowing that you're going to come in here, okay, sclerotherapy, injecting veins, isn't there a high probability those will come back? Or is that?
In inexperienced hands, that is a problem. But we may have somebody who has varicose veins in the calf, and the real problem is up in the thigh, and you can't tell that without the ultrasound. If you don't treat the root problem, the veins are going to come back. So usually we end up doing a combination therapy. We treat the big problem first, and then we work down to the smaller problem, and then it doesn't come back.
So some of the veins, like on the calf, so you may inject those, sclerotherapy, and then what do you do for this other vein? I mean, and that's with what? That's the venous closure?
Yes, that's the venous closure or the Elvis procedure. And with that takes specialized training and equipment that the casual practitioner of veins just can't do in the hospital or in their office. We've had extensive training in that. We actually use the ultrasound, we go inside the vein, and we shrink it from the inside out. We don't strip it, we just shrink it, and then your body reabsorbs that vein, and it closes that big leak.
So you say you're changing people's lives by removing their veins?
We are, and we have a great time doing it. Now, maybe it's not for everybody, but people who have varicose veins, and especially people with pain, we can change their life. Okay. And most of the time, insurance covers that.
How so?
Let me show you a few examples.
Okay.
These are some of my babies. I'll have to show them to you.
All right.
This is a lady in her 40s who's a mother and a housewife, and she also works 8 to 12 hours a day on her feet. She gets such pain and swelling in her legs that she has to stop every couple of hours and lay down and put her feet up in the middle of a grocery store because it just hurt so much. Yes. And she was told by her doctor in the medical community that she had two options. She could wear compression stockings and learn to live with it, or she could have vein stripping. She didn't really want either one of those options, so she came to us. And when we looked at her, we said, you definitely have a problem with that, and we need to do an ultrasound. When we did the ultrasound, we saw right away what the problem was. It was actually reflux or leaking of the blood up high in the thigh, causing all of these varicose veins. So looking at her,
What's causing the pain there? I still don't quite get it.
I do lectures on this, and I could probably lecture for a week on why people have pain when they have leg veins like that. The kind of the simplified version is you have nerves that run with the veins, and anything that affects that vein and causes swelling can cause swelling of the nerve next to it. When the nerve gets swollen, then you have pain. Interesting.
Okay, and that's this vein disease. Is that right? I mean, this is considered vein disease.
It's definitely vein disease, yes.
Okay, so you looked at that and immediately ultrasound, you go, this is an easy one? What goes on in your head?
I thought that this was going to be pretty routine, and I told the patient that I thought that I could make her veins go away, and I thought I could help with her pain, so she wouldn't have to lay down in the middle of the grocery store and elevate her legs anymore. So when we looked at the ultrasound, we saw a problem right away. She had what's called reflux, and we're able to fix that right in the office.
What'd you do?
What we did with her was a venous closure. What we do is, using the ultrasound, we put a little needle in the vein, and then we slide a little plastic tube inside the vein. We shrink it down with radio waves, and then we also did a second step called sclerotherapy, or the injections. She was in the office for about an hour, and then she was walking, and she went home, and her pain.
So 1 hour to get rid of that?
1 hour to get rid of that.
How long do you think she had that?
She had that 20 years, and she'd been suffering with pain for that long.
Really? Insurance covers it?
Insurance covered it.
Okay, so what happens after it's gone? I mean, how soon does her pain go away?
Her pain went away almost immediately, and she said her legs felt like they were 10, 15 pounds lighter. And this is actually a picture of her a month later. She was so happy after this. Not only did she have a great-looking leg, and she was able to wear shorts for the first time in 20 years, but she no longer had to stop in the middle of her shift. She's working full shifts now, and she's not having any leg pain.
Do people become more active? I mean, do they tell you, their legs feel that much better?
They do. Actually, I have several people who are overweight, but they have varicose veins, and they're waiting to exercise until they get their veins fixed. Once they have them fixed, they say their legs feel great, and they get on the treadmill, they're walking, elliptical trainers, weight training, whatever they want to do.
Now, so when you, I mean, by the way, when you see, because I rarely see this, and you say it's common.
Yeah, you probably wouldn't see it because these people are masters at hiding their varicose veins.
Okay.
They even have makeup that they can put on their legs if they decide they are going to wear shorts that will partially hide this, but it doesn't really cover it. And, of course, they're not satisfied either. But I have people who haven't worn a bathing suit in 30 years because they're ashamed of their legs. They haven't worn short pants because their grandchildren said, "What's wrong with your legs, Grandma?"
So nothing to be afraid of. I mean, it doesn't hurt during the procedure.
No.
And they can walk home. They don't have to miss work.
Right.
Insurance usually covers it. So it's just about bringing awareness then.
I think so. And I think as more people recognize that this is a very easily treated problem and that we can do it in the office without the need for hospitalization or anesthesia or all the fees that come along with that, then there are going to be more and more people taking advantage of this and having happier lives.
Okay, good. We're going to take a quick break. We come back. And by the way, some graphic photos coming up. I mean, there's one that looks like literally a miracle story. It doesn't look like the same leg. So we'll get to that. You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. We're talking about advanced treatment options or new advancements in the treatment of varicose veins. And you don't want to miss this next segment. We'll be right back.